There are about 100 million people at any one time with a major mental health disorder. So it's very, very common. Mental health problems are more common than heart disease and cancer combined. And so it is really a huge problem. And my issue has been we've been trying to get medicine to better address mental health. It's a crisis right now. Only 25% of all these people receive any care at all. And most of that's by untrained primary care doctors. It's a major disaster. Here's the problem. Common as it is, primary care doctors provide mental health care for 75 to 80 million people, but medicine does not train them in mental health care. They're completely untrained. And the result is, of course, predictable.
Welcome to Linda's Corner, where we bring more hope, healing, and happiness to the world. My name is Linda Bjork, and today we're going to be talking about untreated mental health challenges. I'm delighted to welcome Dr. Robert Smith. Dr. Smith is a seasoned physician, distinguished professor of medicine, thought leader, and the author of Has Medicine Lost Its Mind? You can reach Dr. Smith and learn more about his new book at his website, robertcsmithmd.com, and I'll include that link in the show notes. Welcome, Dr. Smith. I'm so glad that you could join with me today.
Oh, it's a pleasure. Thank you for inviting me. I'm looking forward to it.
I am too, because this matters. We're talking about an issue that affects millions of people. We have millions of people in America alone who are struggling with mental health issues that are untreated. So can you help us shed some light on why and what can we do about it?
Yeah. Well, I mean, you underscore what you just said. There are about 100 million people at any one time with a major mental health disorder. 1/4 of the entire US population will have a major mental disorder at any time. 1/2 of this over our entire lifetime. So it's very, very common. Mental health problems are more common than heart disease and cancer combined. And so it is really a huge problem. And my issue has been we've been trying to get medicine to better address mental health. It's a crisis right now. Only 25% of all these people receive any care at all. And most of that's by untrained primary care doctors. It's a major disaster. And we've been working, I'm not the only one by any means, but many of us have been working to try to get medicine to do something about mental health, but they don't do it. That's actually, quite frankly, why I wrote the book, and to go to public, to activate the public to insist that mental health care improve. And what I'm going to say may alarm some of your listeners, but here's the problem. Common as it is, primary care doctors provide mental health care for 75 to 80% of the entire population. That's 75 to 80 million people. But medicine does not train them in mental health care. They're completely untrained. And the result is, of course, predictable. They overlook most diagnoses. They don't even recognize a mental health problem for the most part. But when they do diagnose or treat, it's usually substandard. And what happened as a result is by not recognizing mental problems, people who have depression, anxiety, substance misuse are overlooked. That eventuates in things like divorce, job loss, school failure, addiction. When it really gets bad, homelessness, incarceration. Many of these things can be prevented if mental health care problems are recognized. But doctors don't recognize them. Now, don't blame them. It's not their fault.
No.
They're not trained. They're not trained for this. I was talking to a couple of them just the other day, and one of them said, Bob, there's no psychiatrist in my town. What am I supposed to do? And another one said, well, there's a few psychiatrists here, but it takes 9 months to get an appointment. And so I'm getting at here is that psychiatrists see no more than 12% of all these mental health patients. Psychologists see another 12%. But primary care doctors see the remaining 75%, but they're not trained for the job. And the answer to this is simple. For medicine to do it, but they're not doing it. Train the doctors who provide mental health care. And so, I mean, it's crazy that medicine, for the most common health problem in the country, medicine does not prepare its doctors to care for half of them. It's crazy. And so this is why I'm going public with this and trying to get the public involved to make change. An outraged public can affect change.
Wow. Okay, can we pause for just a second? I would
Sure,
like to get some clarification before we go on.
sure.
You mentioned 100 million people have a major issue, and then you talked about depression and anxiety. So when you talk about a major issue, can you clarify? Because right now I'm thinking when we're talking about a quarter of the population, that means I look to the right, I look to the left, I look ahead of me. If one of those doesn't have it, it's me. That's a lot.
That's correct,
So,
though.
so are we including issues like anxiety? Are we including depression? Are we including like
Yeah.
a major depressive disorder or just I'm feeling
No,
depressed?
these are epidemiologic studies have shown that 25% of the population, that's about 90 million, 100 million,
Okay.
25% will have a major mental disorder. It is mostly depression
Depression.
and substance abuse, but it includes other less common disorders like PTSD and
Okay.
the like.
Okay.
Does that answer?
Yes,
Yeah.
yes, yes. So we're the majority of people that you are referring to as the untreated mental health issues, we're talking about dealing with depression, we're talking about anxiety, we're talking about substance abuse, which is considered to be a disorder.
That's
And
right.
also, so these are our main three. And then in addition to that, then we have those things that maybe we traditionally think of as you go to a psychiatrist for, I'm struggling with PTSD, I'm struggling with schizophrenia, I'm struggling with
That's
borderline, those kinds of things. Okay, okay. Wow, for a second there, I'm like, whoa, we do not have a quarter of the population dealing with schizophrenia. Okay, all right. So
no,
now that I'm understanding more
sure.
about what problems we're dealing with, I'm absolutely on board. This problem is ginormous.
It
And I
is.
think we have a mindset as a population that we tend to compartmentalize and separate issues with our body and issues with our mind. Uh, and because of that, in addition to separating it, we also as a society tend to value things that happen with our body. We are allowed to break a leg without shame. We are allowed to have cancer and get treatments. There is no shame in that. However, the minute you talk about struggling with any mental or emotional problem, there's shame and guilt involved. We are not supposed to have those kinds of problems. They are not allowed. And so that is a huge issue. And so now you're saying, okay, when people are brave enough to go and seek help, the place that we go, the place that we are allowed to go, the place that is safe to go, is to our primary physician. They treat physical ailments. We are allowed to go there. We can go there, schedule an appointment, show up in the waiting room. There is no shame. Okay, so this is where I'm going to go because that's what we think. But then we have a problem in that these doctors who have trained for years to be able to gain the skills needed to help us with our physical ailments do not have the training to help us deal with these mental issues. And we're not going to our psychiatrist. We're not going to a psychologist. We're hoping that the doctor can do it, our primary physician, and the truth is, he can't. He's not qualified. So it sounds like what you're suggesting is that we kind of integrate and say, you know what? If this is where they're going, maybe our primary physicians could use a little training. And at the very least, maybe they could turn people to where they can get the trained help that they need. Am I correct?
That is correct, except the only qualification I put, it's very difficult to train existing physicians. Training people in mental health any more than you could train somebody that didn't know about diabetes and heart disease in short order. You can't do it. It takes 4 years in medical school and 4 years in residency to train people in heart disease, cancer, strokes, all the physical diseases. And so accordingly, it requires that much time and supervised training to train people in mental health care. And the point I'm making, where I would need to be clear, is it is not going to work to go out and try to train existing practitioners. The training rather has to go back into the medical schools and into residencies before people ever get into practice. And they need to graduate as competent in mental health care as they are in disease care or delivering babies or doing surgery. They need to graduate as we're not trying to make psychiatrists out of everybody, but they need to be as competent in fundamental, basic mental health care. For example, with depression that comes into primary care, a trained primary care doctor can manage probably 60% of all those patients effectively if they know what to do. They don't right now, but if they did, the data suggests they could be very effective with 50 to 60%. The ones they are not effective with can then be referred to psychiatry or to psychology. And this is the pattern we use with physical diseases too. Now, here's the problem. For the most common health condition, mental health problems in the US, medicine provides no more than 2% of total training time across 7 to 8 to 10 years of training in supervised mental health care. The only supervised training they get is an average of 5.1 weeks in the third year of medical school when they're on psychiatry rotation. That's it. Now, if you talk to deans and program directors, you say, oh, well, we do teach about suicide, and we do teach about chronic pain, and we do teach about opioid use. But if you pin them down, Linda, it's a lecture here and there is all they do. They're just a couple lectures. They will agree with you that there is no supervised training of people other than that 5 weeks. But for example, no supervised training of people who are suicidal, who are depressed, who are anxious, who have chronic pain, taking opioids. They no supervised training. And that is what is lacking. And that's why we have a mental health crisis today.
Okay. So it feels like where you see the solution to the problem, and that matters because we don't just want to make everybody panic and say, oh, we have a problem. We want to find solutions. And the solution you're suggesting is let's improve the training for our doctors so
That's
that
right.
it includes these problems that are so prevalent. I love working with correct information, and I love the idea of making that change where it's going to affect our emerging doctors, our new and upcoming rising generation of doctors, so to speak. I'm a little I'm wondering how much training you're hoping they're going to get, because in my mind, I'm thinking they're already carrying such an incredible burden that to expect them to have the same level of training as our psychologists and psychiatrists would just, run them over with a truck. So our general practitioners, they cover a wide variety of things, and then
Yeah.
they move people off to specialists. Are you suggesting that we get kind of in that area where, hey, if you're planning to be a primary care physician, what kind of training would you like them to have?
They need to be trained in basic mental health care. The doctors I'm talking about will be able to take care of most of that. The ones they are ineffective with, they will refer out. And so the issue of how much training do they require, I mean, you could argue that 50% of all medical training should be mental health, given that 50% of all health problems are mental health problems. Now, that's unreasonable for a host of reasons. But right now, I'm arguing, and this is in the appendices of the book, which I'm sure you haven't read, is technical. But right now, I'm arguing that training go to about 10% of total time and gradually go up to about 25%. Now, these aren't necessarily add-ons to what they do. Rather, befitting a mind-body unity, they will be integrated into existing training. When doctors are being trained for heart attacks and strokes, integrated into that training will be the mental health component. For example, in all chronic diseases, heart attacks, strokes, cancer, 17% have a coexisting depression. And so that will be integrated into that. And if you don't treat the depression, the disease itself doesn't get better. And so it will be integrated into training across all this 4 years of medical school and 3, 4, 5 years of residency. But there will be extra training, and there is apt to need to be some tightening of the training now provided. For example, when I went to medical school, I took 6 weeks, my whole class had 6 weeks of parasitology. These are parasites that occur largely in South Africa and in various other places outside the US. I've only ever seen 2 or 3 cases of that since then. I I didn't get that amount of training in psychiatry, unfortunately, where there are 4 or 5 patients a day that have these problems. And so medicine may have to cut down to some extent on what they now teach in physical diseases to accommodate this. But for the most part, the extra training will be integrated right into the physical disease training.
Okay, I feel so much better about that. Oh, thank you. For a minute there, I thought you were trying to give an unreasonable expectation for our primary physician caregivers, but now
Yeah.
I'm starting to get on the same page. We're
Well,
talking about an
and
overhaul and an integration.
yeah.
And this is huge. And I love how you gave the example of I'm getting training on something that I may have seen 2 or 3 times in my entire career. Whereas we have an issue that is affecting a quarter to a half of the population, and we're not getting adequate training. We need
Yeah.
to do a shift. And that matters so much. According to the CDC, about 90% or even more of issues that we go to see a doctor for have a root cause of stress. They're stress related or some kind of emotional imbalance, some kind of an issue. We have
That's
a
right.
mind-body connection, and Harvard did their own study, and their statistics were a little different. They said between 60 and 90, but a lot, a
Yeah.
lot.
Yeah. Let me comment basically on something you said earlier about, I think you were concerned about overloading the primary care doctor. In fact, they can take care of mental health problems just as expeditiously as they can their other problems once they're trained for them. And it also, what they will find is that they will be more effective taking care of their physical problems when they integrate the person's emotions that you're talking about. And in fact, it will go as efficient, if not more so than it does now by training them to do this.
Okay. Oh, yay. We're on the same page. I agree 100%. We started by making that comment that it is in part of our society that we compartmentalize our
Yep,
physical issues and our mental and emotional issues, and they are not allowed to touch. And the
that's right.
reality is, we are a whole person, and
Yeah.
our emotions and our stress affects our body. And when we try to address them separately, we don't get the results that we will if we address the whole person. Okay. All right. Woo! I love this. Okay. So now that we're on the same page and you have some solutions, and you are a really good person to talk about this, and you have received of the award for a teaching in excellence, so you know what you're talking about, and you have the skills to be able to teach this. So, what do we do?
Well, what needs to happen is medical schools need to change,
I agree.
and basically the medical profession. But it's through the medical schools and training that this mind-body split gets perpetuated. So that the most proximate issue to address is medical school training. Now, I'm not the only person that thought of this. People have been talking about improved mental health and other psychological and social training, stress and emotions and all of that, medicine now excluded. People have been talking about that medicine should do this since the 1960s.
Mm,
George Engel coined what's called the biopsychosocial model for medicine in 1977. Basically, it integrates bio, which is disease, psychological, which is the person, and social, which is their environment. It integrates that together. That's what needs to happen. Medicine, in spite of institutions like the Institute of Medicine within it, there are many people in medicine agree with it and have advised medicine must do this, but medicine doesn't do it. This is why I'm written the book and going outside medicine. And the answer to what you can do is my website that you gave, robertcsmithmd.com. On the front page at the bottom has a place where you can go to sign up to get a sample letter that can be plugged into your own email, and the addresses to send it to are there. And basically, what this is advocating, what the book and I are advocating, is that medicine is that some congressional committee, presidential committee, National Academy of Science conduct a thorough investigation of how scientific medicine, medical education is today. And they will be found wanting in just the way we're describing. They're failing to teach psychosocial things as the biopsychosocial model prescribes. They're failing to do that. And that will then become the leverage to force medicine to change. And many people have talked about this. Hannah Arendt, the historian and philosopher, said sciences must not be allowed to go unchecked of their own accord in their own direction. They must have society directing them in where they want them to go. Medicine is a prime example of the wisdom of that. Society has had no input whatsoever into medical education. Medical education has not changed for mental health in the last 100 years. Society has no input into that. If society had input, they would say, my gosh, start training people for the most common problem they're going to see. But they don't do that. And so this is why society has to have input, and this is what I'm pushing for here. Examples that has worked before. You're probably too young to remember Ralph Nader and Unsafe at Any Speed, or Rachel Carson and Silent Spring. In both cases, recalcitrant institutions focus mainly on saving money, In the automobile industry, they refused to put seat belts in because they cost too much, and their gear shift was wrong, so the car went backwards instead of forward. Ralph Nader's book came out and forced them to change. That's why you wear a seatbelt today, is because they're required. And that's because of that book that came out that did that. Rachel Carson's book came out. The chemical industry, there was DDT in the water we drank. They didn't do anything about it because it cost them too much money. Rachel Carson's book came out, got public upset. That's where the Environmental Protection Agency came from that we have today. And that's why we drink clean water and have other protections. My idea, this book can have the same impact. It has got to get to the public, and the public insists that changes take place. It's a catastrophe now. And in some sense, and this underscores why what I'm saying is correct, medicine does not recognize what it's doing. It's brainwashed with this mind-body split. It doesn't, psychological and social and mental things don't really register on most of medicine's radar screen. They're too focused on physical disease. And they're, in some sense, you can use the term brainwashed into this. And this is why they don't get it. This is why education hasn't changed. This is why nobody is doing anything, even though multiple people like myself from within medicine are telling them they have to change. But they still don't do it. And a problem has come up with that. Piggybacking onto this physical disease focus from the mind-body split, hospitals, insurance companies, drug companies, equipment companies are making tons of money off of the present situation just like it is. They make billions, if not trillions of dollars with hospitals full, taking new medications like this one for obesity that costs $1,000 a month. And they're making tons of money. They are vested in the status quo. Venture capitalists are now getting into medicine. They are vested in the status quo. They care little about patients. They care about making money. Now, let me be clear. Most doctors that I know and deans of medical schools and organizers of medicine are not mercenary. They're not this way. They're simply been brainwashed. But it's this medical industrial complex that has piggybacked onto it, is making tons of money. Friend of mine, Don Berwick, wrote an article in JAMA. It's called Salve Lucrum. Translated, that means profit reigns. And this is the problem today. It's becoming very mercenary at these higher levels from venture capitalists and huge medical organizations where CEOs are making millions of dollars. It's not translating down to the patient any longer.
And that makes me sad because it's about money and not about people. And if our healthcare system is based upon money and upon status quo and upon prestige, I mean, this is what we do because this is what we've done. And if we make any change, that might mean someone might say we were wrong at some point, and I certainly don't want to hear that. And we do need to make some changes. And it is helpful to be able to have some voices who will speak up.
Yeah. And Linda, it's not tinkering at the margin. Medicine, in fairness, does do some things about mental health, but it's all tinkering at the margins. They'll try to work to get better payment schedules for untrained primary care doctors to do mental health. We're talking about what is needed is a fundamental change in medicine as a science, and that will show up in medical education by these radical changes. This will not come from within medicine. They will simply keep tinkering at the margins and wondering why it doesn't work.
Okay. And you've given us some concrete things to do. And I think one very important part is we need to become aware. Because
That's
if
right.
we're not aware that there is a problem and that there's something that can be done to change the problem, it's not, well, this is terrible, but there's nothing we can do about it. We need to
Yeah.
become aware and recognize that a change is possible and that a change will improve it. And then between putting those things together, as you're giving your stories and giving these examples, I was thinking of a very long time ago of, I believe it was Dr. Lister and the childbirth fever, where at the time, the common way to show that I am an experienced, prestigious doctor is I have blood and guck all over my apron, all over my clothes. When you see that, you're going to see, oh, they're experienced. They've done this before. And there was a time where the doctors, the physicians would go directly from doing post-mortem care to doing pelvic exams on expectant women. And then the mothers and the babies would get sick and die. And they just
That's
called it
right.
childbirth fever. We don't know why.
Yeah.
It's just this thing that happens. And when Dr. Lister became aware of of germs that they were introducing, in fact, causing the deaths of these mothers and babies, he actually went mad trying to get people to listen because they wouldn't hear him. And yet, in time, they found out that what he said, what he was saying all along, was right. And now, if someone came in all dirty and gross and tried to go from there to there without washing their hands, I mean, there would be public outcry. So
That's
you
right.
are this next generation of saying, okay, what we're doing is not helping. In fact, not only is it not helping, it may actually be hurting. And it is time for the next level of change. So I appreciate you speaking up because we do need a change. And thank you. And here we are together trying to do our part to help people become aware. Become aware, and let's use our voices together in a way that helps people to make a change. And at some point, hopefully in the future, it will be as normal and common to be able to get the help that we need for our mental illnesses as it is now common for doctors to wash their hands. It is possible. So thank you for visiting with me today. Is there anything else you want to make sure we cover before we close?
Just underscore what you said. No need to wring your hands. There's something you can do and something that, and it can be changed because it's been done before in other areas. So we're just getting started.
Thank you. I appreciate your time and your wisdom. In closing, I'd like to share a quote by Glenn Close. She said, "What mental health needs is more sunlight, more candor, and more unashamed conversation." Today, I invite our listeners to join us in shedding more light on mental health. See you next time on Linda's Corner. Thanks for tuning in to Linda's Corner podcast. If you enjoyed this episode, please subscribe and share it with your friends to help us inspire even more listeners. Be sure to visit hopeforhealingfoundation.org for free and affordable resources to help you overcome life's challenges. And explore healingbreathworkdetox.com, where you'll find transformative tools for deep inner healing and lasting change. Also, don't forget to check out my books, Crushed, A Journey Through Depression, and You Got This, an action plan to calm fear, anxiety, worry, and stress. Your journey to hope, healing, and happiness starts here.